Midwives, gynecologists of Reddit. What's the weirdest thing you heard from a pregnant woman or her family that made you think they had no prior sexual medical education? I had a girl call the office because she swallowed a cherry seed and was worried that the baby was going to choke on it. For some reason I'm thinking of Luann from King of the Hill. I've told this story before, but it bears repeating. I worked as a telephone triage nurse and received a call from a very concerned young lady. She said that she was pregnant and had gone to an appointment with her OB-GYN that day and had some questions. This was relatively common. Patients can sometimes feel rushed in the doctor's office or forget the questions they were going to ask, so they call and ask us later. Me. Okay, no problem. How can I help? Pregnant lady. Well, the doctor told me I can't have any more sex until after the baby is born. Me. Looking at her record in the computer. Okay, I see you're pretty far along and were having some preterm contractions, which can be caused by sex. So the doctor recommends no sex so that the baby doesn't come too early. Pregnant lady. But how will I feed the baby? Me. What? Turns out, her male partner convinced her that babies needed to eat semen to develop, and this could only be done with PIV sex. I told her this was totally wrong and gave her a quick lesson about the umbilical cord. She was skeptical until I pointed out that single women and lesbians have perfectly healthy babies without constant sex. Oh, okay, that makes sense, she said. Then she thanked me and started to hang up the phone. I could hear her calling her partner's name as she hung up. Would have loved to have been a fly on the wall for that conversation. Oh my god. I'm a midwife. I was booking a woman at the beginning of her pregnancy and she wasn't exactly pleased about being pregnant. I asked her if she was sure she wanted to continue the pregnancy. There's no point me booking her if she wants a termination. She starts ranting about how it was the soft drinks industry's fault and how she's going to sue them. I was pretty confused at this point and asked her what she meant. She informed me that she had been washing her vagina out with cola following sex and that she must have bought a bad batch as she was now pregnant. I went to see a woman who had delivered her first baby a few days previously. I knew she had had stitches but she seemed to be in a lot of pain. I asked her if she wanted me to check them and she consented. And when I did, I got a strong whiff of chemicals. I asked her what she was using to clean her vaginal area with. We advise women to just use water for the first few days. She told me she was using Dettol, a household disinfectant here in the UK, as she always used it in her kitchen and she'd never got ill from her food. So it must work in preventing infections. A few words with me and when I saw her the next time she was moving around freely like she was in a Tampax commercial. This one isn't really to do with sexual education but was really a WTF moment. We have bags that are given away to new parents and they have free samples in baby wash, fabric conditioner, nappy cream, etc. I examined a baby who was 10 days old and her skin was almost red raw in places. I thought it was the worst case of eczema that I had ever seen and that she should get the baby checked out at the hospital. While I was trying to get through to them, I asked her if she had been bathing the baby in anything. Again, we advise using water only for the first couple of weeks. English wasn't her first language but her husband came home at that point and translated for me. They had received a free sample of fabric conditioner in the pack. This had a picture of a smiling baby in the front. They assumed this was baby soap, had bought a massive bottle of it, and had then bathed the baby in it. Neat. Luckily the baby had no lasting effects. Attention. Humans with vaginas. Douching is bad. Douching with cola is very bad. I work in public health and family practice. We get our own special ones. Most recently the lady with chlamydia that stated she did not use birth control because you cannot get pregnant if you have an STD. Right. Yes, she knew she had the STD and yes, she was sexually active. Well, she isn't completely wrong. Some STD do in fact cause fertility problems. However, I would not rely on that as a method of birth control. Not a midwife but do medical triage over the phone. Had a 19-year ring because of abdominal pain. Asked further into the assessment as she was pregnant. She is. Call changes tone. How far along? 37 weeks. Could you be in labor? She doesn't think so. I just need to put the phone on my bed while I get changed. Why are you getting changed? But embarrassing. I think I wet myself. Do you think that could be your waters? She sounds skeptical but grudgingly agrees it could be. I ask if she can get to the hospital. No, everyone in the house is drunk. I ask if I can send an ambulance. She doesn't want me to as she has a house full of people watching the match. This is during the football world. My mom did this with me. First kid. Apparently her water was just a trickle and she changed underwear like 4 times. My dad just laughed at her, gently, while trying to convince her to go to the hospital. We had a woman come to Tridge one day, in no visible distress, but certain that she was in labor. She denied feeling any loss of fluid, contractions, or pain. When questioned further, she explained that she was already dilated for. She was accompanied by her granny, who explained that she had checked her granddaughter at home and she was able to fit 4 fingers inside the vagina, so she knew it was time. Not in the cervix, in the vagina. No, granny knew. Obligatory, not a doctor or midwife, but my friend with multiple kids had a yet another pregnancy scare months ago. She said she thought she'd be protected since she had taken the morning after pill a month before. She also told me some time ago that she wouldn't bother with the pill anymore because aside from side effects, which I understand, they can be awful, it didn't work and she still got pregnant on it. I asked her if she took it every day and she said well I'd miss a few days here and there but it still should have worked. Oh geesh. No girl. No. I had a cousin that had a friend that told her a way to save money was to stop taking her birth control for 6 months. Friend told her that birth control pills were still effective for 6 months after taking them. As you can guess, she ended up pregnant. It was the only reason we found out about her genius money saving plan. Not a MW or Gino but a story from a doctor in a town where I used to live. A man and wife had a daughter. Then he somehow, farming accident, lost her testicle. Then the couple had a son a year later so all his parts work, right? Then a few years later they have another daughter. All heck breaks loose in the maternity waiting room between the two families. His family is insisting that the mother was fooling around because he lost his girl testicle in the accident. The doc had to separate them. Then had to give a lesson about reproduction right there to explain that men's testicles aren't made to be one to make boys and the other to make girls. Members of both families were apparently confused about it, he said. I wonder how many men throughout history would have cut off their girl testicles if it actually worked that way. It goes like this. Me. Your pregnancy test came back positive. PT. Oh, I couldn't be. Me. Are you sexually active? PT. Yes. Me. Are you using any birth control? PT. No. Me. Then why don't you think you could be pregnant? PT. Because I couldn't be. Me. Repeat seen many times over past 20 years. Denial is not a river in Egypt. A shocking number of women think they cannot get pregnant if they are breastfeeding or just haven't had a period yet after giving birth. A lot of teens think if their period is irregular, they are somehow unable to conceive. You do not have to be menstruating regularly to get pregnant, folks. A lack of a period is not some natural birth control. Also, I see a lot of women who for some reason think they can't conceive after the age of 30 and are shocked when they get pregnant at 35 or 40 or even later. I'm a guy. I've had women tell me I don't need a condom and then after a few basic questions it becomes clear that they just kinda feel like they can't get pregnant or just won't right now. Okay, I'm not going to debate a woman about women's biology and fertility, but I'm sure putting a condom on, as I have the right to choose to be a father, the one without a uterus, I believed. Dad was a high-risk OB-GYN. Once had to argue with a woman that her daughter emphatically did not get pregnant from swallowing, despite her protests that her daughter was a virgin, to which my dad replied he was only aware of one previous virgin birth in history. When my great-grandmother went into labor with her first child at 18 she asked how the baby was going to come out and the midwife said the same way it went in love. Midwife saying, in like a banana, out like a pineapple. Neither, but my high school principal used to work in juvie and told me about a pregnant 14-year-old who insisted she was carrying Jesus reborn. Turns out her father was a pastor and had her convinced he couldn't get her pregnant because he was her dad. Honestly, I never got the talk but had unsupervised access to the internet since I was like 12. That's really sad and horrifying. Very young girl, barely 13, came in for symptoms of a UTI. Pregnancy test came back positive. Her and her mother claimed that could not be possible because you can't get pregnant until you're 18 inches. When asked why they thought that, mom said, well, if that wasn't the case, why would they put warnings for pregnant people on cigarette packs? And the daughter genuinely thought that only grown-ups can have babies. Not an MW or Geno, but one time I made out with a girl and the next day she was crying because she thought she was pregnant. We were 22. When my uncle's ex became pregnant with my cousin, I thought I was the father because I hugged her one day when she was babysitting me. I was 9 when that happened. My mother is a midwife and this one story sticks out. A couple is in her office looking very somber and the woman has been crying. Mom, what brings you in today? Man, this points to a spot on woman's lip. Mom, looks like a cold sore. Man, what are we going to do about this? Mom, have you tried a breather? Man, that is for herpes. Mom, yes, this is a form of herpes. Man, I knew it. Check her for gonorrhea and chlamydia please. Mom to woman, ignoring man, have you ever had a cold sore before? Woman, yes, in 2012. Mom then had to go in circles for 20 minutes with the man about how it's not sexually transmitted necessarily, how it's very common. She didn't cheat on him since she had it for years, and that he probably had it. He cursed my mom out for accusing him of having an STD after she said that last bit and stormed out. My mom had to have a come to Jesus talk with the woman about leaving this loser. Crazy how little people know and how angry people get about how ignorant they really are. When I was a medical student on my OB rotation, I saw a young girl who was pregnant but swore that it was impossible. I asked if she was on any birth control and she said that she didn't need it. She said that her BF was kicked in the balls. A lot. I lost it at the a lot. Not a midwife, but I had an acquaintance try saying that she was only pregnant for 6 months but that her baby came out full term. Like her child was fine and needed zero medical attention due to being so premature. I don't think she was actively lying, but she was not a bright person. She might have found out she was pregnant at 3 months and just assumed that she was just newly pregnant by the time she found out. Or maybe she felt bad for drinking partying early in the pregnancy, so she refused to acknowledge it until it was convenient. Either way, it sounded very fishy. Not a midwife, but did have an acquaintance who got pregnant while her husband was in the army deployed. She had convinced her husband that they needed to try and get pregnant. So how did they resolve the issue of long distance and time? They concocted the plan of using a turkey baster, where the husband actually mailed a package of his little soldiers to her and she used the baster on herself to impregnate herself. No doctors were consulted during this time. And this story all came to light in divorce court when someone actually convinced the husband the baby was not his. My dad worked as a hospital orderly to put himself through college. He told me that he went to clean up half of a double room. The other half was occupied. Sitting in the bed was a girl who was somewhere between 14-16 going through labor. She was in agony on the bed, her mother holding her hand. And a teenage boy who was most obviously the father was crying in the fetal position in the corner. Eventually, the girl's father came into the room, seemingly having just heard that his daughter was pregnant. She was very small and it must not have shown well. The father threw the teenage boy against the wall and screamed at him. "How the frick did this happen?" he screamed. Through tears, the kid said, "My brother told me it wouldn't happen if we were standing up." Midwife here. I had a couple booking with me and I'd delivered their first child. Her booking bloods showed chlamydia. The husband nonchalantly said they were being treated and she probably caught it from her previous birth. A slight mail order bride situation. Yes, I used my chlamydia gloves to catch their other child. Another woman who was pregnant with number 9 in 9 years was on the antenatal ward. I was discussing contraception with her as she'd never had time to before, and we'd recently started placing IUDs immediately after birth. English was her second language and she was amazed she wouldn't have to have another baby in a year. Her face was a picture when I showed her the vasectomy handout. Oof, I feel for the mother of 9. Sad how some cultures and places have such minimal sex ed that folks end up in such a position. My dad was a GP. He retired about 10 years ago. He had a couple, lovely people, very young, a bit unworldly, come to see him to discuss their failure to conceive, about 30 years ago, when I was 10 or so. He was bright enough to ask what they were doing in bed. They had both somehow come to the conclusion that what was needed to make a baby was penis belly button contact. I have no idea how anybody was getting any satisfaction, or how on earth they kept believing this after doing it once. It must have been a horrible experience. He explained, literally, the facts of life to them, and on coming home had the talk with me and my brother, just in case we were all so stupid. The couple in question ended up with 2 kids. Good old dad. While deployed, we had an Afghani man come in with his wife for a fertility check. He made it very clear they'd been married for over a year and she hadn't conceived, and if she was incapable of conception, he was going to divorce her, dishonor her, send her back to her parents, ruin her life. Apparently, it never occurred to him the fault could be with him, not his wife. First idiocy. The doctor was willing and had the time to sit and talk with him. She wasn't allowed to speak. After an hour of questioning and careful probing through an interpreter, it was discovered this man had no idea what the vagina was for. He'd been forcing anal sex on her since day one. Second stupidity. She was still a virgin. The Canadian doctor had to explain to him about penis-vaginal sex. Even draw him a diagram to show him the proper way to have sex. About a year later, he came back to thank the doctor, who was gone. She gave birth to a healthy baby boy. If she'd had a daughter, I doubt he would have come back because, you know, the sex of a baby is all up to the mother and the father has nothing to do with it and the woman chooses the sex. Huge eye roll. Also, girl children are useless. That's the worst I've ever seen as a medical professional. A woman's life was literally on the line and a man's uneducated stupidity was the deciding factor in the entire equation. Jesus, the fact that that last sentence in your story is so applicable now just as it was then, just as it was a century ago. Freaking chills, man. A friend of mine works labor and delivery and told me this story. A 13-year-old pregnant teen comes in. Days like this for the staff are hard, and they're trying to be as sensitive as possible. As they're getting her ready for delivery, she starts to panic, saying that the hole isn't big enough for the baby to come out. She thought the baby was supposed to come out of the belly button. Similar but related incident. I worked as a photographer for a crappy newborn photography scam service that the hospital provided. I go into a room one day and notice a young woman, maybe late teens, early 20s. Right away I notice she seems to have a sort of tick-in ability to recognize social cues. Whatever, no worries. I start making small talk about her newborn. I say something along the lines of, "Oh, you had the baby on the 1st of this month. What excellent planning on your part, haha, you know, because you can't expect when the baby comes." This woman stares a little blankly at me and says she didn't know she was pregnant until she started contracting 2 days prior. I talked with my friend later, and she says that they would get a lot of mentally intellectually disabled women come in pregnant or in disbelief that they were pregnant because they didn't know or understand what sex was, or because they had been raped and didn't realize it. I don't know how we monitor it, but intellectually disabled people need to have access to sex and consent education too. Also, sorry op, I know these probably weren't the funny stories you were looking for. Not a midwife or gyno but patient here. I asked if my twin boys could see each other in utero. The nurse laughed and said it was pretty dark. I was 35 and it was not my proudest moment. I don't know what I was thinking. Pregnancy brain. It's real. Mother is an OB. She always says that the amount of people who don't understand that you need to take the birth control pill daily is unbelievable. She hates abstinence-only education. It leaves her with patients in their 30s who don't understand how STDs are spread, how you actually get pregnant, or that sex can be enjoyable for women. Abstinence-only education is the absolute worst. I once had a classmate tell me she made her boyfriend wear 2 condoms during sex, for added protection. I do ultrasound. When I was a student, I did a rotation at a small OB-GYN clinic. One day, a woman and her husband came in for a pelvic ultrasound. They had come to see the doctor because they were having trouble conceiving. They said they had been having sex regularly for almost a year and had not gotten pregnant. My instructor asked the patient if she was on medications. Standard question. Only my birth control pills. In a year of trying to get pregnant, neither she nor the husband had thought maybe she should stop taking her birth control. You should rename the birth control pills into the German name, anti-baby pill. Maybe that helps. Not a midwife, but I knew a lady who refused to drink coffee, not because lots of caffeine is bad during pregnancy but because she believed that coffee would turn her baby black. Of course, coffee makes them black, chocolate brown and tea yellow. Not a midwife doctor, nor did this story end with an actual pregnancy, but the fear was there in the boyfriend. I was talking to a guy I knew and he was super somber. He told me that his girlfriend was pregnant. He had led me astray before, so I asked for details. Did she take a test, see a doctor, etc. He said that her period stopped, therefore she was pregnant. I had to explain to a 25-year-old guy that women didn't bleed 24/7 and that your period ending for the month wasn't a symptom of pregnancy. Imagine going through life thinking all the women in the world are bleeding right now. Not any of these, but I did work with a girl that thought she couldn't get pregnant if she was on top. Found this out after she got pregnant. My high school Spanish teacher ran a sexual education program in the Peace Corps for women in a South American country. Most of these women were already married and had many children, but couldn't afford to keep procreating because they could barely afford to feed the children they had. My teacher and a few other women went over how to use condoms. They explained all of the steps for putting it on, using a banana as a stand-in penis, and then distributed free condoms to each of the women. In the next few weeks, they noticed some gaps in their explanations. For example, my teacher was riding her bike home one day and noticed one of the local women hanging condoms up on the clothesline to dry. The woman had been washing them and reusing them. However, the biggest misunderstanding came 2 months later when another woman came to see my teacher. She was screaming and very hard to understand, but my teacher gathered that the woman was pregnant. My teacher explained that it's not a foolproof method. Condoms can break, etc., and asked the woman to walk her through how the condom had been used so they could better expand on the issue. The woman replied by saying she had done everything they instructed. Before having sex, she would roll the condom on a banana and put it next to the bed. TLDR. Peace Corps instructor demonstrated condom usage on a banana. One woman became pregnant after putting a condom on a banana when she and husband had sex. A heavily pregnant woman put her finger in her belly button and pulled out something gross. She immediately freaked out, making her husband freak out as well. She called my friend, who is a doctor specializing in OB/GYN, and almost cried on the phone. Prego, help. I just pulled something out of my belly button. My friend, MD. Yep, prego. So, have I removed a plug or something? Have I hurt the baby? My friend, MD. But you just pulled something gross from your own belly button, right? Prego. Yeah, but isn't my belly button connected to the baby's belly button? Isn't that how she gets all of her nutrients and stuff? And then they had a long talk about the uterus, placenta and where our belly buttons originate from. Mind you, this isn't about the prego not being educated. She is a lawyer, but she caught pronounce a brain and had a laugh about it afterwards. Not a medical person, but I have a friend who called me one day and told me she was pregnant. I knew she wasn't seeing anyone and was pretty sure she was the type of person who wouldn't have sex outside of a serious relationship. So this was shocking to me. I asked her who it was and she said she wasn't sure, which also confused me. I asked her to explain what she meant. It turns out she didn't get her period when she expected it, so she figured any must be pregnant. She was in her late 30s and definitely not pregnant. Son of an OB/GYN here. Story 1. Patient: I can't be pregnant. OB dad: why not? Patient: we haven't had sex. OB dad: have you been naked together? Patient: yes. OB dad: has his semen ever made contact with your vagina? Patient: yes. OB dad: bad news, those little guys are swimmers. To this day I still wonder if the dude has to pay child support or not. Like, my American people, Your Honor, I did not have sex with that woman. Story 2. Fat woman didn't know she was pregnant until giving birth. OB dad said family was very excited for her in spite of being surprised. Story 3. Fat woman claimed she was pregnant, claimed she was in labor. OB dad had to explain to her and family there was no baby. Family freaked because they'd all been buying her stuff. She started yelling that he'd taken her baby. The ruse was unreal. I heard she ended up in the news later trying to kidnap a child, claiming it was from the pregnancy that didn't happen. not a medical professional, but one of my friends in college told me that it took her mom having at least 2 or 3 children before she went to the doctors to ask why she kept getting pregnant. I think she ended up having 5 kids in total. Turns out there is such a lack in reproductive education in South Asia that the poor woman who was married off in her late teenage years literally had no idea how exactly pregnancies came about. Despite having moved to Europe, my grandmother asked her OB when she was pregnant with my mom how it happened. This would have been 1953. My grandmother was 20. She had no idea that sex caused pregnancy, and my grandfather didn't know she didn't know. This was the US. I am ashamed I was the person. I am a 41-year-old, married female with no kids. By choice. I had to have a nurse on Reddit tell me that indeed you can get pregnant by sperm just being in your passage, meaning on the very front of passage. Minimal penetration. Either the penis had to go deep and maybe even penetrate the cervix. Yup, lucky I have an implant. I was an unplanned pregnancy. One guess how I was accidentally conceived. The cervix isn't really something that is penetrated by a penis. I'm no expert, but as the owner of a cervix who has also had a child, if my husband so much as joked about trying to get up in my cervix, I'd probably lock up the coochie right then and there. Having doctors basically finger my cervix to see how dilated I was is one of my top 10 most painful things I've experienced. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.